Welcome to Biztech's Health and Wellness Show. Our guest for today is Datuk Dr Kuljit Singh. He's the president of the Association of Private Hospitals of Malaysia, as well as a medical director at Prince Court Medical Centre. Now, to tell us more about this, welcome back to Biztech Asia, Datuk Kuljit.
Hi, Brian. How are you?
Good, thank you. Now, Doc, could you give us an overview again for the benefit of the audience of what APHM does?
APHM is an association which is solely representing private hospitals in Malaysia since 1972. So we are 51 years old, and we are the only vehicle whereby private hospitals can become members. And we are not a union. We are not a regulator, but we work as one voice for the benefit for our patients so that we can negotiate with the government, with other stakeholders, so that private hospital business and also our delivery system to the patients can be made more seamless. So one of our main activities is that we regularly do an academic conference yearly, whereby we get experts throughout the world and throughout the region to exchange ideas. And we also have a trade exhibition, which this time in 2023, we have got about 210 booths with major vendors, which normally supply hospital equipment to all of our members. And we have 155 members out of the 210 registered hospitals in Malaysia.
So, Dato, now I want to zoom in on and take a look at what we were speaking about previously. Previously, in our last conversation, when you were in Biztech Asia over a year ago, you mentioned that the gaps were exposed during the pandemic. There were a lot of gaps in the Malaysian healthcare system. We're post-pandemic now, borders are open. What have been the changes that have happened, not only in the private healthcare sector, but also in the public sector?
We have suddenly realized that the surge of patients that are coming to private hospitals have tremendously increased. Of course, the public hospitals had always had a lot of patients, but what we have seen, which is very different than what we used to have, is the number of patients visiting private hospitals are very high comparatively, and there could be many reasons for it. One of the reasons that we think is because during the pandemic, many patients didn't really have the opportunity to keep up with their health. And you now see them coming with multiple conditions which require treatment. So in this search of increased number of patients, now we have got other issues, like we are not able to expand our private hospitals. We're not able to open up more beds for this increased number of patients because we don't have nursing. Our nursing staff in private sector is actually, we are sometimes working on a very lean amount, because in private hospitals, we have to follow the Private Facility Act, which dictates very clearly the number of beds that you open has to be together with the number of nurses that you have. So that is our concern and our challenge that we are having right now. There are a lot of patients out there are willing to pay for private healthcare, either through insurance, pay out of pocket. They have no issues. The cost, I don't think so, is a major issue. Looking at the number of patients actually waiting in a private hospital to get a bed right now. So I think that is a major challenge that we are facing right now.
So Dr. Kuljit, here, that's an interesting problem. That's a problem that can be solved in many different ways, one of which is obviously takes time, which is essentially start training more nurses from the get-go. The other shorter-term solution is therefore to hire foreign nurses to alleviate this issue. I'm sure that you've engaged, you and your members have engaged with the government on this. Where are we at in terms of solving this problem?
So our latest engagement was actually yesterday with the Minister of Health, who officiated our conference. And we made it very clear that, we need this leeway from the government to allow us to bring foreign nurses. Now, right now, they only allow us to bring foreign nurses if we can prove to the government that we don't have sufficient nurses within the country. So that's got a process to prove that. Number two, we can only bring nurses who are with post-basics. Post-basic means they are specialized, highly trained nurses, and only those are the type of nurses that we are allowed to bring. But currently, that is not the type of nurses that we require in this country. What we require are the normal nurses to run normal wards. So these are the leeways that we have asked the government to give us a moratorium at least 2 to 3 years to allow us to bring in these nurses to fill in the gap, so that the local nursing colleges will be able to ramp up to get them qualified to become nurses. So right now, the number of nursing joining the colleges are also less because of the pandemic. And then we do not have our own nurses that who can serve private hospitals, because I must say this, our nurses are very much in demand internationally. They get jobs very easily in Singapore, in Middle East, and even in Australia. And they have been taken away from us by these countries, and we are left with very, very few nurses. So we have gone and spoken to the government. It's been a year we've been talking to them about this. There is very little traction so far on this, and I hope with our interaction yesterday with the minister, we should get somewhere.
Okay, so Dato, this is an interesting point that we probably need to talk about in a separate conversation as well, because Malaysia, we've gone through a boom-bust cycle in terms of too many nurses, and then now we are too few nurses. A few years ago, it was a problem of too many nurses coming out of the nursing institutions. But the other thing that Dr. Kuljit, you've been a big advocate of, and in your engagement with the government, and APHM has been at the forefront of this, is really advocating private-public partnerships with the public sector in order to utilize equipment and facilities better. Walk us through what has been done, particularly since the start of the pandemic, where I think the first initiatives were accelerated.
So during the pandemic, because it was an emergency, and we worked very well. In fact, that decision of doing a public-private partnership was almost an overnight decision. And the very next day, we had started the process of accepting patients from the public sector. It was so seamless, to our surprise, that we really felt that it wasn't much of an issue doing this partnership. But then again, we must remind ourselves it was an emergency, so a lot of red tape was not there. But after the pandemic ended, we see that the partnership is slowly kind of slowed down for many reasons. One of the reasons is, of course, funding and processes. So during emergency is different. So right now, the government is embarking into a policy how it can be done in a way that is more structured. During the emergency, there was no structure, but now they're looking at a structure so that we can dedicatedly get capacity ready for the public sector. Patients from public sector would be able to get into a private setting through a system whereby we can look after patients who are waiting long in the public sector for treatment. So the discussions are ongoing, and we had one engagement with the Ministry of Health just about 2 weeks back, looking at how we can have a policy on this. And the policy has to be such that, it has to be also beneficial to the private sector in terms of paying the cost of doing this partnership. We are okay with discounts. We are okay to give an agreed amount which will be beneficial to the government to pay to the private sector to see some of the patients. We have certain hospitals in the private where capacity is actually available. But again, I must say that there are some hospitals in private we are totally full. So we will have to strike this balance and see which are the hospitals that we can actually assist the government with their patients. So to answer your question, yes, the process is ongoing. We're refining it. They're looking at a policy so that we strengthen this partnership.
Now, one of the interesting things, and I want to highlight this to the audience, is the natural reaction for most people will be, oh, if the private hospitals are getting into the act and getting referrals from the government, it's going to cost the government more money. But recently in a forum which I attended, which you spoke on, the actual fact is studies have shown that for certain equipment and certain procedures, in fact, if you do the total cost of treatment, the private sector may actually do it a little bit cheaper than the government can for the government. Could you walk us through some of the examples and the studies that you've done to actually illustrate this point?
So we are in the belief that in private, because we run a business, So when you run a business, the cost effectiveness of every process, every treatment, every procurement that we get into, there is a huge amount of view that is given and attention is given to the cost effectiveness. So we are in the view that we can actually provide a service at a rate which might be a rate that they need to pay, and they may not be used to the fact that they have to pay a particular amount. But looking at the long term, we are in the belief that we can actually make it cost effective for the government. Because for the government to build new facilities cost them a lot of money, and then to equip, plus engaging and retaining human resource in the public healthcare system can be a challenge. I just spoke about nurses living overseas, working at countries which pay them more. You can also imagine the number of doctors who will actually leave the public sector to the private sector for very obvious reasons, because they're remunerated better in the private. So it is better we partner in a way that experts that are in the private sector can actually serve back the public, but of course with a payment. So the payment that we charge, because we run a business, we definitely make it very cost effective. I think most countries in the world, and not just in healthcare, even in Malaysia, we have seen the government outsources a lot of their services to the private sector, not in healthcare, in other sectors, because they have calculated very well to see that they actually are more cost effective when the private does some of the services that the public sector need to do. So we have seen in telcos, we have seen in other areas. So I think it's high time that we can work together and actually save a lot of cost to the government, especially as far as healthcare is concerned.
Now, Dr. Kuljit, I want to move on to now something that is very close to the heart of APHM's members, is of course medical tourism. Now, since the reopening of borders in early 2022, basically Malaysia has witnessed a resurgence in foreign patients seeking medical care in the country. Could you give us some update in terms of the numbers that are present today? You know, have you had a full recovery, and what's the growth factors that you're forecasting moving forward?
Okay, we can see the trajectory numbers of patients that are coming in from overseas for medical tourism is extremely steep. In fact, I was just informed we are almost reaching the total number of medical tourists that came in 2019, just in the month of May, up to the month of May. So a lot of patients from the neighboring countries have started coming to Malaysia, and we have already safely recovered as far as medical tourism is concerned. And in fact, we are doing better than expected.
So where is this growth coming from? Because traditionally it has been Indonesia that's provided this growth.
So Indonesia is our main supplier, but we do see patients coming from other parts of the world. We have patients beginning to come from India, Bangladesh, some parts of Africa, and we also have patients coming from China. And surprisingly, there are some pockets of patients from Europe who make their way to Malaysia for wellness, for treatment like screening and those kind of things. So yes, Indonesia is the biggest, but we have new markets that are actually getting into Malaysia. Now, one of the reasons is because we are very cost effective. Comparing prices and the level of care that Malaysia gives, we are actually the most affordable when you compare to the other countries within our region. So when medical tourists make this kind of comparison, then they are very confident to know that the dollar that is spent in Malaysia is actually much superior than what they would get in any part, not only in the region, any part of the world. So actually, we are trying our best to cope with the insurgence of a high number of medical tourists right now, to be honest.
Now, in the light of this success as well, and in this current environment, the APHM has just announced a partnership with the Malaysian Healthcare Travel Council. Tell us about this, and And how is this going to move the needle for you as and your members?
So MHTC is a very important body that we work with, not just now. We have been with them from the inception of MHCT. Now, the important thing in medical tourism is the government support is pivotal. Patients can always walk into our country on their own, but there could be a lot of issues sometimes the medical tourists would end up facing, particularly if they don't go through a government agency. So MHTC recently has created a different level of partnership with our hospitals, not with APHM directly, but with the hospitals. They have got the elite hospitals. Now they have flagship hospitals, which are listed within their portal. And each of these membership, so to say, they have got some special privileges for patients who sign up with these hospitals. So if a medical tourist goes through MHTC, that virtually makes it seamless for the medical tourist to seek treatment in our hospital. So whether you're an elite hospital or a flagship hospital or even a normal member of MHTC hospital, then MHTC makes sure that the patients have got all the required border control documents, and they facilitate everything that is required for a medical tourist to have the confidence to come to our country. So that partnership with MHTC is very important, because without that, we can sometimes have difficulty. Not we as a provider, and even the patients may have some difficulties, which is quite global, that you go any part of the world. If you don't have an agency to help you, then it can be difficult.
And that, I think we shouldn't underestimate, because it's all about customer service, isn't it? So if MHTC can provide that frictionless entry and exit into Malaysia, you as a service providers under APHM provide that affordable quality service, then you have repeat business and obviously word of mouth that goes across.
Yes, I think that is the main aim why the government created MHTC. It is now under the Ministry of Health, and it is pretty independent. It's got its own board, it has got its own council, and it makes a lot of difference even to the government, because medical tourism is also a revenue generator for the government, because there is a lot of revenue that is created by medical tourists when they come to the country. So our partnership with them is very good, and we work very closely with them. And we see the success of medical tourism in Malaysia has got a lot to do with the working relationship that we have with MHTC.
Now, what new initiatives can we anticipate from APHM for the remainder of 2023?
I think the important thing is we need to have more support from the government in many other areas. The government tend to look at private healthcare as an expensive affair, and sometimes we try to refute it. In fact, we don't try, we do refute it, that we are not expensive. The optics of private healthcare sometimes looks expensive to the man in the street, because in private healthcare in Malaysia is where you pay, where the payment and the price tags are very obvious. Whereas when you take healthcare treatment from the public sector, there are no price tags. So it is taking us some time to explain to the government and also to the public that private healthcare in Malaysia is not expensive. What you're paying for is the actual cost. And if you make a comparison with the countries around us, not to go beyond around us, you can find that we are still very much at a level which we will say is affordable. Now, it may not be affordable for a B40. We can totally understand that. But for the T20s and some of the M40s, I think we are giving something which is of value. And our main task now is to hope that the government doesn't get onto us to control our prices to a level that we may not be able to function. So everyone would think that you can bring down healthcare costs. That's a myth, because all over the world, healthcare costs will increase. It has never been a situation whereby you see the healthcare costs coming down.
Yeah, most of the time it's just controlling the increase rather
It's controlling
than
the increase. Yeah, we are
That's
okay
it.
with that. We are okay with transparency. We are okay to make sure that we run a business and we want it to be competitive enough. And I don't think any private hospital would just go to a level that it's become so unreasonable that will just kill the business. We want to provide a service. At the same time, of course, we have to have some amount of profits for our shareholders who have invested in healthcare. And if there's no profits, no return on investment, then there's not going to be any private healthcare. So we have to strike this balance in making sure the healthcare cost doesn't increase, but at the same time to keep us sustainable.
Dr. Kuljit, it's been a really informative session. Thank you very much for coming on the show.
Thank you, Brian.
I'm Brian Fernandez, and we've been speaking to Datuk Dr Kuljit Singh. He's the president of the Association of Private Hospitals of Malaysia and medical director of Prince Court Medical Centre. This interview will be on our website, www.biztech.asia, as well as our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in.